Yeah, preliminary data from the state found more than 1,800 people died of a drug overdose in Colorado last year. That's up from 2024, even as overdose deaths dropped around the U.S. But whether this ballot measure would help to turn that trend around depends on who you ask.
This is Graham, the older one, and that's Spencer, his little brother. They both were beautiful and loving, had very bright futures.
Photos are all Teresa Cobley have left of her boys, Spencer and Graham. Both died from an overdose.
Graham died at the age of 17, so he did not make his high school graduation. My son, Spencer, struggled for 10 years.
In just a few months, Colorado voters will decide on a ballot measure that would increase criminal penalties for dealing and possessing fentanyl.
Our goal here is to save lives, and I think that this measure does that.
Republican George Bronkler is the district attorney for Douglas, Elbert, and Lincoln counties and campaign chair for Advance Colorado, the conservative advocacy group behind the ballot measure.
It holds accountable, la-di-da-di, everybody who gives fentanyl to another person and it kills them. If when somebody gives fentanyl in whatever form they give it to them, and it's the proximate cause of their death, then they face mandatory prison, 8 to 32 years in the Department of Corrections.
And it would make having any amount of illegal fentanyl a felony. Some low-level users could get that down to a misdemeanor with court-mandated treatment.
It is easy to say, oh, well, we'll just get them treatment. But if you're not going to fund treatment, if you're not going to create additional access to treatment, all you're doing is creating a more of a burden on the system and putting people punishing people who need care.
Kyle Giddings with the Colorado Criminal Justice Reform Coalition says by removing the reasonable mistake defense, people could be charged even if they don't know they have fentanyl on them.
We hear it over and over again of people losing their lives because they didn't knowingly have fentanyl on them, and making that some of the highest level felony charges is counterproductive and will cause even more deaths in our community.
After losing 2 kids to addiction, I hate fentanyl more than anyone. And what I think is needed is public health solutions, prevention and treatment, not prison beds.
That measure will go before voters in November. Live in Denver, Rachel Krause, 9 News.